Abortion rights activists are here at the People's House in Hagåtña to testify on Bill 162 that would update Guam abortion laws. The measure seeks to repeal what bill author Senator Will Parkinson calls unnecessary barriers to abortion services. For instance, the measure would allow for virtual medical consultation, would remove the requirement that physicians must tell the patient the possible sex of the fetus, and other information that could guilt trip patients out of seeking an abortion. Joining me now is Stephanie Lorenzo. She's the executive director for Femalaw and Rights. So Stephanie, why would a proposal like this be good for Guam?
So, my apologies. So it basically removes the three barriers that our residents have to face in order to receive medication abortion. So the first is they have to meet in person with a qualified person listed in the Guam law. That is to include, I believe, a nurse, social worker, psychologist, physician. The second is that they actually have to read a booklet called A Woman's Right to Know, and in that booklet they have to be informed of the probable gestational age, the support services that public health provides to support child development, and just so much more. And then of course the last barrier is the 24-hour waiting period. So Guam residents have to wait 24 hours before 24 hours before the process can even continue. And this is all on top of the patients already meeting with physicians. In particular, the Queen's Health Clinic in Hawaii, they are actually the only business that is providing medication abortion to our Guam residents. And so the residents that are interested in seeking medication abortion services, they have to do a telehealth already with these doctors, and then they have to meet with the in-person counseling.
Right, and if this bill doesn't pass, what would that mean for reproductive health care access for our community?
So it basically means that if the Queen's Health Clinic was to just maintain providing services to Guam, that all interested residents will have to go through those three main barriers. It is the in-person counseling, the 24-hour waiting period, and they are required to read the Women's Right to Know booklet.
Thank you so much, Stephanie. And now here's to what others had to testify during the hearing. And why are you against this bill?
Well, you see, when you this bill, the way they have it and are presenting it, they're bringing it about to say like they're modernizing and updating the information. But if you ever look into the history of what this law, the Health Information Act of 2012, is actually a law that was written way back, started in 2009, and I remember being around. It came out in protection of women. It literally is a law to protect women, and now it's being turned around to say it's a law they're going to help women. It's not. This law was written to help and protect women that were involved in rapes, incest, sex trafficking. Those things were very prominent back then, and so the only way to protect the women actually was to allow the women to consent, to be informed, and to give actual consent to the abortion.
And why do you think this bill wouldn't do that?
Because this bill is removing all the protections for the women. It's removing everything that the bill was written about. It's removing it all. It's removing the informed consent. It's removing the privacy. It's removing everything that has been put in place for many years to protect women from being forced or making an uninformed decision.